Welcome to the Discovery Doc podcast, where we advocate for optimal wellness and reducing everyday toxic loads, no matter where life takes you. I'm Dr. CeCe, doctor in nursing practice, self-proclaimed toxin tamer, and a crunchy mama.
I'm Annah Kate, a medical mystery overachiever and your discovery liaison. Join us on this exciting journey as we explore the world of holistic health, cutting-edge research, and practical solutions for a healthier life. Together, we'll navigate through the complexities of wellness, sharing valuable insights and expert advice.
Tune in to the Discovery Doc podcast. Get ready to be inspired, empowered, and discover a whole new way of looking at your health.
Welcome back to the Discovery Doc podcast. I'm here with your host,
Dr. CeCe, functional medicine nurse practitioner, self-proclaimed toxin tamer, and a crunchy mama of 4 by this point.
Oh, wow.
No? Will it be?
Maybe by the time this airs, we may have, or he's almost.
If
here
he's
on his
early,
way.
it'll be mama of 4.
Yeah.
For now, it's mama of 3.
Oh.
And my co-host over here.
I'm Annah Kate, your medical mystery overachiever and discovery liaison. And we've got a very handsome face.
Oh.
He's not gorgeous. He's handsome. I mean, he is gorgeous. So, so we brag on all of our good looking guests, and he is absolutely fantastic and handsome. And I'm going to tell you more about Dr. Ken Redcross. He's here. He's an author.
Yeah.
Did you know that? And a founder of a concierge practice where he gets in to all the nitty gritty with his patients, and he works with everyday health challenges and embraces both natural and alternative medicine in his practice. So, hi, Dr.
Hello.
Redcross.
Thank you for having me on. I promise I didn't pay for that intro, but you can have me back anytime you guys want me to. You see, it's the light. That's why I keep moving so you can't see my blemishes. Thank you for having me on. I am so excited to be with you guys. You know, when I do these podcasts, very rarely do I get into ones that kind of speak the same language that I speak, to where it's not all about prescriptions and the Western side, which we can go there. But I also love this space because this is kind of where we're going and where we get a lot of the health and healing.
Yes. So we are just so happy to have you. You are a breath of fresh air,
Oh.
and you're the first man.
Second.
Oh,
Second man?
Yeah.
Oh, my husband.
All right now. See, I don't want to cause any problems at the home front. Sorry, Will. It was just a little slip up. Don't take it personally.
Will can kick your butt. He's an MMA fighter.
Oh, okay. And I'm a
We don't wanna start
CrossFitter,
anything.
but I'm not going MMA because if Will gets me to the ground, I don't know how I fare
It's
that
over.
way. It's pretty much over.
Wait, that's hysterical. He's going to kill me.
And
How funny.
I will say I am the daddy of twins since you were talking babies.
Oh.
So you're 3
Yes.
plus 1 soon, and I'm 2 and ready to ship them out soon. We'll see.
Oh,
Are you going to be an empty nester
I
soon?
am. That's why I
Oh
say
my
shipping out
gosh.
in a good way is they're going to college
Yes.
soon. So they're doing all the college.
Wow.
you don't look old enough to have college.
That's why I
twins.
said I
don't.
keep moving, ladies, so you can't see all the blemishes here. So there you go.
So, Dr. Redcross, can you please tell our community so they can get to know you?
Sure.
Who are you? What's your background? How did you come about to practicing or integrating a little bit more of alternative, holistic, natural medicine into your practice today?
Yeah, look, I appreciate that. So it's interesting. So I am a Western trained doctor. I trained at Columbia here in New York. And really, after my training there, I went out to California and I worked with migrant Mexican farm workers on the strawberry fields. And that was always an important thing to me to always give back. But it was in California where I learned that people were getting better without prescriptions, without my prescription pad. I'm like, hold on now. How did you get better? What are you taking? And that was when they started to talk about a lot of things that I always say that are closer to the earth. And I started to really resonate with me. So my last name, everyone, is Redcross. It's a Native American last name. So I remember as a child going to powwows and that sort of thing where there was already kind of a spiritual way to heal. And so around that same time, I started to recognize that this whole thing that I'm doing, it's really all about people. It's about all of you listening or watching now. And I said, you know, I don't feel like I'm able to resonate in the typical healthcare world where you get about 7.5 minutes with your doctor. So that was when I had this idea. I had a person who worked for a big time executive in LA when I later transitioned to my second practice in the Beverly Hills area. And she needed to make sure that her producer was being seen by someone. He wasn't feeling well. And something came to me in 2007 to say, you know what? Tell him I'll come see him. So I took my stethoscope. She got me on the lot of Universal Studios. I went to see him, and he's like, "Oh my God, this is the best." He's like, "Doc, this is great." I was happy because he was elated. He was happy because I
Yeah.
was there. So he says, "Doc, what do I owe you?" And I said, $100. He said, $100. And he wrote me this big check. And I was like, a model is born. So therefore, I started to recognize that for me, it was all about this, getting into the soul of the patient. So I transitioned my practice until it was really full of more love than it was that rat race that we all kind of get into in current healthcare. So I practice regular Western medicine, but my practice is really heavy on the holistic side of healing now.
Amazing. So what is your typical patient population? What does that look like?
So I do a couple of different things there. So I have in my concierge, everyone, I have a couple of different companies. I have my kind of more medical driven, where I'll have those who are maybe entertainers or athletes or business people. And then I make sure that I give time at an assisted living facility in a dementia unit. So they're a large portion of my patients as well. Remember, it's about getting into the soul of the patient. So no matter kind of where I am, whether my patients that I have in Quebec City or one in the Basque region of Spain, which is gorgeous, I would love to make a house
Yeah.
call out there one day. And
Let's
then
all go to
those
Bath.
at the assisted living facility, the dementia unit, and so forth. So my typical days, I am crazy blessed, everyone, and that I am able to kind of not have one day be the same. But I make sure to touch as many souls as I can along the way.
Beautiful.
It's very rare. That's
It's very
rare
refreshing.
and very refreshing. Yeah.
And are you full concierge?
No, well, I shouldn't say that. I am, but what I do is a little different. I mentioned those other areas, everyone, because I do it this way through the camera. But I also have I also make house calls. Here's my little doctor bag card. You guys can see it. So I make house calls, especially to the elderly who I help age in place. So I do a bunch of different things in my practice that, keeps it fresh. And once again, touching as many people as I can.
I can so relate to that because in my practice, it's a functional medicine practice. So I have a lot of chronically ill
Yeah.
patients who have kind of just expired conventional medicine, or they haven't gotten answers, or they've gotten told that they were crazy and it's all in their head.
Right.
And
Right.
this is one
Right.
of
I
them.
get it. I get it.
And they're just looking for someone to look outside the
Yeah.
box, and I have peds and kids and adults, but then the other side of it is my, like, heart and soul are my well visits.
Yeah.
Like, I do conventional well visits, but very holistic in nature, but my favorite part of those is I do house calls for newborns.
Oh,
And yes,
the
because someone
best,
I
the
had
best.
so our last baby we had at home, we did a home birth, and my midwife was like, "Do you do house visits for your patients?" And I was like, "No." And she's like, "Why?" Like, how amazing would it
Yeah.
be for a mom who just gave birth to not have to go to their pediatrician and put on a diaper
Right.
and put on their baby's
That's right.
diaper and then lug a huge bag to their pediatrician for the baby's first appointment? And I was like, "Oh my gosh, you are right." But it is such a different
It
connection
is.
to go into their home and to kick your shoes off and sit on their couch and pull out your
I
laptop
agree.
and just talk to them and be in their environment. It's such a different connection.
No, it really is. And, it gives those four things that I talk a lot about: trust, respect, communication, and empathy. And when you're there, right there in the space of the newborn, in this case, there's nothing better than that. And the other thing is, I'll have to step back for a second and give you props, Dr. CeCe. And the reason why I say that is when you talk about functional medicine, everyone, look, I've been in practice over 20 years. As I mentioned, I'm Western trained. Functional medicine is something that really wasn't talked about as much. And I tell you, with all the functional medicine docs that I have and so forth, are absolutely amazing in the way they look at health and healing. I learn
Mhm.
from some other functional medicine docs as well. So I have to give you props because it's a different direction. It takes a lot of courage
Very
to heal
different.
that way. And so that's why it was exciting to be here, to be able to kind of mesh our philosophies because they're so similar,
Yeah.
especially the way that I've kind of, morphed into this different sort of physician now. So thank you.
Yeah. I'm
True.
flattered.
It's true. It's true.
But it is It is a very different philosophy. Like what I was taught in school, how to interpret labs. Like if you just go down to basic CBC, how I
Right.
was taught to interpret that, I look at very differently in my chronically ill patients than I was taught. And it's same guidelines, same baseline, but with extra attention to certain detail that can be overlooked if you're in an urgent care setting or an ER setting where it's like, okay, that looks great. It's fine. It's fine in that setting, but it's not fine for a chronically ill patient
Exactly.
who hasn't gotten any answers.
Exactly.
So it is a very, very different philosophy. But as you've kind of grown and morphed and found where you feel the best practicing, what other modalities have you I'm so curious. What other modalities have you started to implement into your everyday practice that you weren't taught in school
Oh my
necessarily?
gosh, how much time do we have? How long is the show?
Yeah.
I don't want to keep you guys
This is going to be a longer
I
episode.
know. We were
part
like, this is gonna be
7,
30
right?
minutes.
Part 7. No, look, one of the bigger ones for me is well, I guess one or two. Look, one of them is the simple thing, right? Exercise. We all know the importance of that, and I really call it movement. To be quite honest, because everyone calls exercise something differently. Doesn't mean you have to be like me sometimes, who's a CrossFitter with the big kettlebell. It can be Tai Chi and some of those natures, but the real magic I find is kind of on the spiritual side of healing. I talk a lot about the importance of meditation and the balance that meditation offers. In fact, if you guys would have come with me 20 minutes ago, you would have seen me in here meditating with the light chant
Mm,
as well. Once again, kind of that spiritual connection that's hard to get in this world right now, and hitting that
yeah.
pause button. So those are the kind of things that I love to talk about so that people won't forget. You don't have to meditate for an hour. I just did 10 minutes. It was enough.
Mhm.
Center me, balance.
Mhm.
And that was some of the things that we're missing in healthcare right now, especially as, the world's becoming a little bit of a different place.
Right. Absolutely. And that's something on a chronic front I talk to my patients a lot about because we can give as providers, we can give you all the tools. We can give you all, whether it's prescriptions, medications, supplements, natural agents.
Mhm.
But if your body physically, spiritually, emotionally is not aligned to healing and health, then you will never feel as optimal as you could if they
Mhm.
if they were aligned. And some of it is very basic, in my opinion. Your meditation, what does that do to your cortisol
There
levels?
you go.
Whew,
Brings them right.
right?
Exactly.
Yes, to your central nervous system function. It alters your neurotransmitters. It helps everything that fight or flight feeling settle down. And we can't heal if we're in that stagnant fight or flight, you know, just method or mode. So I love whatever it is. I'm grounding, meditation, prayer,
Sure.
just
Also.
anything that helps calm down the CNS and our fight or flight feelings. So I'm right on board with you
Lock it,
with all of that.
lock and step, right? And as you mentioned that
Yeah.
decreased cortisol levels, one of the things that I know functional medicine docs talk a lot about is inflammation and the ability for that
Mhm.
to cause what I say is dis-ease and the importance of that. And
Yeah.
meditation helps with that as you talk about the cortisol levels. And so, it's
Yeah.
important, everyone. One thing you're seeing and getting from our discussion is that there's not kind of a one size fits all approach. There's a lot of different ways to kind of come at this health and healing thing. So I'm glad
Right.
we're talking about it.
Yeah.
Us
So
too.
before I've got an important question
Sure.
for Dr. Ken. Before we get into your proactive steps that you take towards diet and lifestyle, I want to know what's in your cup. What's in your morning
Oh,
cup beverage?
Of choice.
What's your yum? What is it every
look at
morning?
that.
What do you
Perfect
put in your
timing. We didn't even plan this. For me, it's 3 to 4 cups of green tea a day. So I'm a big
Okay.
green tea guy. I do that because look, the data is there. It's very important. Once again, it's a little bit more medicinal. I do a black tea at certain times, but it's that green tea where we know there's so many important kind of chemicals in there, which have been proven. So that's what's typically in my cup. Or I usually throughout the day only drink water or tea. I don't add
Mhm.
anything calorie wise other ways. Coconut water, but you got to be a little careful about that. But in the cup today, and usually it's green tea.
Guy
Awesome.
after my own heart.
I know. She's a
I'm a
tea
tea
girl.
Oh,
drinker.
She's a tea
nice,
girl.
nice.
Yeah,
I know.
I love
But
all kinds
she
of
she
teas.
gets real fancy with it.
Uh-oh.
She does.
I had an oat milk chai
Oh,
today,
yeah.
and then sometimes I have like a ginger peach. Um, like
Yep.
all kinds of stuff. And I also actually got her started. I make my own kombucha. So I got her started on
Impressive.
kombucha, and she
Yeah.
got one of her nurses started on
hmm
making her own kombucha. So that's kind of a big
Wow.
thing. Her littles are
I know.
really
Oh, my 2-year-old, she like this morning, she goes, and you have to ferment it and make it, and it takes a while. And
it
she
Yeah,
takes
doesn't
time.
yeah.
really get that. Like she sees it, so she wants it right now. And I'm like, baby, it's not ready. And she wakes up and she goes, Bucha, bucha,
Oh,
mommy,
how cute
bucha.
is that? I mean,
I
what
know.
2-year-olds in America know about kombucha, right? Mine didn't,
Exactly.
so big props to you. I didn't educate them
That
on
we have
kombucha yet.
fermented ourselves, and
Yep.
we use the beet mixture, and it
Yeah.
is to die
Oh,
Good.
for.
I bet
Yes,
you it
you
is.
add in like a little either like root vegetables or
Mhm.
something in the second fermentation process. And so what was it? It was beet
Beets, ginger, and turmeric.
Oh,
and
I
then
made a puree and brought it so she could put it in. So I want the kids
oh,
to make their own.
yeah.
We'll get Scobies and let them make their own hotel. So it's that prebiotics and I
yeah.
just want them to experiment and do the things. But I love that Jada. They drank. I brought over a bottle and they drank
Oh
it
my
all, and they're
gosh.
Oh,
like,
that's
"Can you bring us?"
awesome. I
Yeah,
So
can I
know.
have more?
I need to bring another one.
We
No.
digress. So
I
ab-
wanted to know what was in this cup. So
about kombucha.
yes,
So to you, as not even just as a medical doctor, but partly as a medical doctor, but also as a dad
Yeah.
or a spouse, what does being proactive in wellness mean to you? And what are some things that you implement with your own family to stay well?
Well, a lot of it, and it's interesting. You know, my twins have learned at a young age what I feel about meditation and prayer as well, and bringing those things in. Those are kind of, I always tell them, they're kind of your secret, your secret remedies that can really make a big difference as well. And with that balance and their exercise, they exercise differently. You know, my son is, he likes to do the little weights and that sort of thing. Sophia's a cheerleader and finds her exercise that way. And so when we're outside of the home, we do our best to kind of make sure that there are some segments. You know, they're doing the school thing, doing the best that they can, and that's fine because, I think when they're fully cooked, they'll be fully cooked. But in the
Mhm.
meantime, it's making sure that we have some different segments of what really makes life life. Even, for myself to realize it can't be all about work, 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 that there is a huge
Yeah.
family component because it gets back to that balance, the yin and the yang, right? And so we need to make sure that we're thinking about life holistically because I just think it makes it a little bit easier along the way. So we kind of proactively I kind of evangelize that the best that I can, just to
And
make
now
sure.
a word from our sponsor making this podcast possible. I want to tell you about a game changer for me this flu season, and that's oscillocoxinum by Boron. These melt-away pellets are my first defense for any flu-like symptoms. Clinical studies show that oscillo reduces the severity and duration of fever, chills, fatigue, and more. No water is needed, they simply melt away in your mouth. Head on over to boronusa.com and use the coupon code TheDiscoveryDoc1 for 20% off your next order of Oscillo. Check out the other Boron essentials for this winter while you're there, including Cold Calm and Throat Calm. Claims are based on traditional homeopathic practice, not accepted medical evidence, not FDA evaluated. And now, back to our show.
Just to make sure that they realize that part of this health thing is about balance. It can make a huge difference in their lives, and hopefully they grow that way.
mm-hmm.
Right. And that's something that they will be able to apply no matter where in life they
Yeah,
are. If they're going through really stressful situations, that's something they can come back to. And I think that that's huge. That's huge. And that's a big reason as to why we do a homeschool hybrid with our kiddos. So they're in
oh, that's
school
nice.
part. Yes, it's so cool. They're in school part of the week and then they're home part of the week. But it's just creating that balance while they're this young.
Right.
They're only 7, 5, and then the 2-year-old, where yes, you get your work done, you're learning, you're thriving, you're growing, but you're also still playing and being
Yeah.
outside. And we do weekly every Sunday. I'm like, okay, hey guys, these are the options that we have. Pick one, and it's some sort of just wellness modality. It
Nice.
might just be, going out. I mean, they're outside constantly, but it might be like a little Epsom salt bath,
Hmm.
or we have a sauna for my husband. So it might be spending 5-10 minutes in an infrared sauna once
Nice.
they get past a certain age.
Nice.
Just certain things like that. But for you guys, or for your patients, and I know those are two very different
Hmm.
subsets of humans,
Right.
but how does food and diet and or are you a big supplement guy where you have, your kiddos on a certain regimen to help keep them well, or for yourself, how does diet and supplementation play a part into any of your just staying well
Yeah, yeah. So
protocol?
look, I appreciate that question. One of the things that I talk about on the fitness side of things is I do this 60-40-20. I make sure that with each meal that I get 60 grams of carbs, 40 grams of protein, and 20 grams of fat, healthy fats, nuts, and things of that nature. That's the balance that I find works well just for kind of everyone and for my training as well. It's also a complement with all those things of kind of the three important vitamins that I talk about, especially during cold and flu seasons. When you talk about vitamin D, vitamin D is gigantic. It's not about bone health, everyone. It's about what it does for our immunity. Vitamin C, we're
Mhm.
all very familiar with since we were kids, so we know that. And vitamin E, when I mentioned getting that healthy fat and the C's that you get, with vitamin E, that's also immune boosting as well. And so when I talk with the kids about getting those things, it's interesting. Vitamin D is something that's really not easy to get unless you supplement it. People will say, "Oh, I drink a lot of milk."
Thank you for
It's
saying
true,
that.
right? It's true because milk is fortified. You drop it in there. The best way to get it
Yes.
is a way that most of you are not going to get. Fatty fish livers, not going to happen. That sort of thing. So fatty fish. I
Yum.
know you're like, let's do this. Um, you know
Give it to me.
exactly. So you try to get it. So that gets back to the supplementation side of things. So I make sure that most people in my family, without a level, and this gets back to what you said, Dr. CC, about looking at the labs as my Western medicine hat and then looking at them kind of with my Eastern medicine hat. Vitamin D levels are different when you look at the
Oh.
Western levels. They're not correct. And
Mhm.
so vitamin D is a big part. Vitamin C, ashwagandha, which is supportive for balance. Turmeric, which you mentioned before. So we weren't too off
Mhm.
base with the kombucha before. We were right on where we needed to be.
Mhm.
Um,
Yeah.
so I talk about those things all kind of being about. Oh, and I should also mention with the kombucha, what you're really doing is feeding a great microbiome. So I have them on
Mhm.
Mhm.
probiotics as well. All of these things are important to kind of once again get that mix of health and healing that we're putting into our bodies each and every day.
Absolutely. We
He's singing our
He
song. I
is.
love it.
You are. You absolutely are. And I love that you said that about vitamin D specifically because a lot, I think it's just been ingrained that, hey, okay, if we drink milk and we spend a little bit of time
Right.
outside, our vitamin D is great. But then I can't tell you how many patients come through my door and I get a value of
There you
22,
go.
21, 22,
Hmm.
or right on the cusp of 30, 31.
Right.
And I'm like, I don't want you right on the cusp.
Nope.
Like, vitamin D is, like you said, it's not just about bone health.
No.
It is about immune health. It helps to
Mhm.
synthesize testosterone.
Right.
It is so important to our hormones as well as our
True.
immune
Very
system
true.
that I don't want you, skating by. I want you at a good 60, 65, 70, depending on, your age and whatever. But I think it is trained that if I just spend a couple minutes outside and I drink some milk, that I'll be good to go. And so many people are deficient.
Let's shoot for optimal, not minimal.
Yeah.
Yeah,
Hey,
yeah,
that
I
was
like that.
great.
I can't. I'm doing it
Trademark.
from virtually. You're right, absolutely.
Yes.
You're right. And
Yes.
vitamin D. Don't forget, you're down there in beautiful Georgia. I'm up here in the Northeast in New York. There's no
Yeah.
sun, so you're not going
Right.
out
Mhm.
there right now for a few months. And the studies always bear it out. The Northeast is always the lowest, and Seattle, Pacific Northwest, those sort of things. And that
Yeah.
also gets back to vitamin D for mood as well.
But
Another
yeah, I was just
important
gonna say
thing.
that. Mhm.
So you're right. The vitamin D discussion is a good one to have, especially during this time of year.
Yeah. What other kind of lifestyle factors or routine factors would you say are essential to our overall wellness and being preventative in our health as well? Obviously, for us, sleep is a big one,
Mhm.
and keeping that routine.
Yeah.
Is that something that you stress with your patients or with your family at all, with keeping a good sleep
Oh
cycle?
gosh, big time. And I'm glad you mentioned it because look, the CDC mentions we're supposed to get about 7.5 hours of sleep each and every day. Sleep, lack thereof, is back to that inflammation story. Also, back to an immunity story. When we are actually getting rest, everyone, we have these killer T cells are coming out of our lymph nodes to fight whatever's circulating around. But if you're not getting enough sleep, guess what? You're not fighting those things. So when you try to get the sleep, one of the biggest things you can do is go to bed on time. You know, all the sleep hygiene stuff. Be careful with having a TV in your room. Be careful of the blue green light. Make sure your bedroom is around 68 degrees. They actually had a study that said 68 degrees is good. The point is a little nippy, but the point is
Yeah.
there is that sleep is medicine, just like food is. And those are things that we can do, that we can control. So I like to talk, you know, when it's during the season, we talk about things we can do to keep our bodies healthy. But I like this little category when there's things that we can control each and every day.
Right.
And sleep is one of those things that's pretty easy to get if you put your mind really to it.
Right. And an interesting little, this nothing to do with anything, but a little to do with something with what you just said, because I don't think enough people realize that what you said about the natural killer cells or the T cells while you sleep, because I think a lot of people know that, hey, my body can kind of heal and rest when I sleep, but they aren't aware that, oh, my body actually fights things when I
Yeah,
sleep. And so
good
this is a
point.
conversation I have with some of my patients, because they will have these wild night sweats and wake up drenched, and it's not hormonal whatsoever.
Right.
But if they're suffering from some sort of underlying chronic bacterial infection that hasn't been found, I will find oftentimes they have associated night
Yeah,
sweats, and hey, it says your immune system is
that's
working
right.
while you are
Mhm.
while you are sleeping. So I think that was really important to just elaborate on a little bit more, so because I don't find that that is a common known
Right.
fact amongst my patient population, at
Yeah,
least.
lots happens in sleep, the rest and repair, and you
Yeah.
can't grow and take care and do the repairing that needs to be done without the
Hmm.
rest. It's part of the go is the rest that happens to make the whole complete body. If
Exactly.
that makes sense.
It
Let me
does.
switch T's brain around
No,
real
no.
quick.
She sometimes makes sense, sometimes doesn't. You can tell
I,
her if she does or
I'll
it
just
doesn't.
She's got
say I'll
pregnancy
just say
brain and
preach. I'll just say preach. You are
Yeah.
right. It may not even be a Sunday, but still preach, because you are right. You're absolutely right.
it is so important of, and the same thing with supplements and working out
Yeah.
and doing all the things, that there's a natural rhythm to things, that it can't be all gung ho,
All the time.
all the
That's
time. There
Right.
true.
has to be that ebb and flow.
And there's benefit to the subtle changes.
Yes.
I think that's also something I know from my patients who they're like, well, and I think this is just society and everyone's on the go and we're so busy
Hmm.
that we're like, well, what's that 5 minutes going to do?
Yeah.
What's that 5 minute meditation going to do? And I'm like,
Everything.
everything.
Hmm.
Yeah.
Like,
Yeah. Good way to say it.
that small little change, that small little 5 minutes where you are calming yourself, grounding yourself, or, making that decision to take your vitamin D that takes 30
That's
seconds.
right.
Those
Yeah.
little changes can really accumulate to help either prevent illness or to maintain wellness. With that being said, I would love to pick your brain on what are some of your favorite or go-to kind of closer to earth remedies, either for your patients or for your own family.
Well, actually for both. And especially when you talk like cold and flu season and things that we're dealing
Yep.
with, one of the big things, especially when my kids were younger, is to make our lives easier. Especially when we know they're going to get the inevitable cold or flu, especially during daycare time when it seems like they have a cold
Hmm.
5 days a week or 8 days a week. And you're like, what can I do? So one of the things I talk
Yeah.
a lot about is oscillocoxinum. It's a homeopathic remedy. There we go.
Wait,
Wait,
Tio.
time out. Okay, you have to
Okay.
say that
Right.
again.
So in my world, patients know I am not good with medical
Right.
terminology. I make my own words up all the time. Like my brain can only hold so much information, and my brain
Right.
expires when I get to that word.
Yeah.
So I stop it at oscillo because
Oh,
I can't say it any further than that. So please repeat that
I will
word.
repeat it. You could do this in slow mo. Oscillocoxinum. Oscillocoxinum.
Oh,
Oscillocoxinum.
Perfect, perfect, perfect. It takes a course.
Okay.
But the good
Yeah.
thing
it
is, the
does.
most important thing, the reason why it's funny, my twins can say it perfectly because they've been taking this since they were probably 3 or 4, because you can take Oscillo at 2 years of age and older. So around three or
Yeah.
Yep.
four, they love it because number one, it makes them feel better. So look, there's plenty of studies out there, published studies that talk about it decreasing the severity and the duration of flu-like symptoms, right? The other thing that's important is that they love the taste. It's these little sugary
Yeah.
pellets.
It's
And
fun
it's
for
fun.
them.
It's fun. They
Yeah.
go right under their tongue. It's great for families because I can take it on the go. We're a big traveling family. So my kids were traveling with us at 2 to 3 to when I can use that. You can't walk around with that cup and pouring liquid all into this cup with artificial
Right.
flavors and this fake bubble gum. I assure you, there's no bubble gum in there. And so
Right.
that's one of the things that's important. So in my kind of toolkit, it's oscillocoxinum, for kids that are 2 years of age and older. And oscillo's been around for over 70 years, so good data on the safety. Also, cold calm. I like this as well on
Yeah.
the go. Doesn't take pills, and these things don't interact with any other medications or cause side effects. The cold calm is good for kids, I think 4 years of age and older, and they're melt-away tabs. Once again,
Mm-hmm.
simple, easy. Remember, with the flu, body aches, chills, fever, but with cold calm or colds, we're talking upper airway stuff, runny nose, stuffy nose, congestion. That's where cold calm is great. And one of my twins, Sophia in particular, would get sore throats. So I also love
Mm-hmm.
homeopathic throat calm, which also is great for the occasional sore throat and that sort of things. And so with homeopathy, it became a big part of my practice because of the lack of side effect, drug to drug interactions. Once again, they were over the counter and they made our lives easier. And so many of my patients were young families just like me. They were like, oh my gosh, it's such a godsend. Now, anytime you're
Mm-hmm.
talking anything with our kids, I always say if anything is kind of still looking a little off kilter in 48 hours, that's when you call your doc. That's when you
Right.
check in to see, well, I don't know, Jimmy or Tommy or Ann isn't getting better. What do you think? It's been a couple of days. So, those are things that are kind of closer to the earth in addition to some of those vitamins that we mentioned before that I give to the
Mm-hmm.
whole Red Cross household, the kids and the older father I take care of as well. He's on it as well.
Nice. And you've
Yeah.
you've talked about that before
Mm-hmm.
as just standard practice of, hey, when these things pop up, let's try the
Homeopathic.
homeopathic approach. I'll get there
Her
in a
words.
second. And trying to do
Yeah.
some natural things before we step into that prescription side.
Yeah.
But at 48 hours, if it's
Yeah.
needed,
Yeah.
let's reassess and reevaluate and see where we are. If it's just kind of like that tail end that it gets worse before it gets better, or if we need to step in with,
Yeah.
with something
You should
rougher.
you should see my pantry. My pantry is filled with boron products. All the homeopathy. You got
Yeah.
any ailment, I have homeopathy for it. But I think it's, as step aside from my practitioner brain as the parent
Right.
brain, I think the biggest fact to homeopathy is that it's so safe
Right.
that even if I didn't have the knowledge that I have, I can go into my pantry, I can clearly read what these things are for, what they can help with. I can give them safely to my
Yeah.
children or to myself without worrying about side effects, without worrying about, interactions or any other contraindications that might, happen between certain herbs, even really strong
True.
herbs and medications. And it gives parents a sense of empowerment where, hey, I can do something
Now.
right now
Right.
that's straightforward, that can
Exactly.
help my kiddo, help alleviate symptoms or help alleviate symptoms for me without any adverse reactions. And then, yes, there's always something I preach all the time. There's always a line, right? There's always a line. Then when, okay, if things aren't getting better, then I need to check in. Um, for those who may not be as familiar, I think it's important to touch on just briefly the other differences with homeopathy versus herbs or herbal extracts or tinctures, and just how homeopathy, when you are taking homeopathy, what is it physically doing? What is the point of taking homeopathy? How is it different than, let's say, taking an antibiotic that's meant to directly kill something?
Yeah.
Is that something that you're comfortable touching
You
on?
know, the interesting thing is that so when we talk about antibiotics, everyone, keep in mind that during this cold and flu season, there's really no need for antibiotic at all. Antibiotics help with bacteria. We're talking about
Right.
viruses in this case. So I don't want you to go to the doctor's office and think you need to walk out with a prescription, because if the doctor is doing what's probably best for you, it's about these things we're talking about. Homeopathy it's fascinating in that homeopathy, they have this, it's like the law of similars. Some sounded like the
Yeah.
similar symptoms you have. Homeopathy has almost a remedy against that to make things better. It's a very almost quantum form of healing. And I love that. And especially when you're dealing with the herbs and so forth. The reason why I lean on homeopathy even more so is that think about what's happening as far as in healthcare now. It's hard to get in and see your doctor. A lot of the homeopathic things, whether it's the oscillocoxinum, cold cough, throat cough, guess what? I can go down there today and start now while I wait for that appointment and call back to be able to go in and see my doc. Herbs I love as well, but herbs sometimes, especially for some people who don't necessarily have the education around them, they have to be a little more careful about them. So homeopathy, the big kind of claim to fame for me in my practice, it's the safety. It's that safety profile that just I can sleep and know that they're most likely going to get better before even that appointment, but also that things are going to be safe depending on what they're taking. I have patients who have heart failure or COPD, lung disease, everyone, that I have to be able to say, I feel comfortable that that's not going to interact with their inhaler or with their diabetic
Right.
medication. And so, homeopathy allows me a lot of peace of mind.
Right, 100%. And then that peace of mind translates to the patient's peace of mind
Yeah,
too,
it really
where they're
does.
more comfortable taking it, I would say also if that comfort is there and that trust is there, then compliance is higher as
Exactly.
well.
True.
Because there's the fear is taken away from it. And so, yeah, I love homeopathy. I love it. I think it should fill everybody's
Yeah,
cabinets. So for cold and flu season,
especially.
we got your we got your top 3, but that is absolutely in the Brooks household as well, our go-to. As soon as someone shows any sort of symptom, I'm like, all right, what we got?
Yeah, no, you're right.
And
And
we've all been taking it for years, and we still don't know how to.
you
No,
had it before,
no.
but I'll tell you this, one of the things that you pointed to, which I think is important, everyone, homeopathy in particular during this cold and flu season, it's about the acute stuff. It's not for the chronic stuff. It's not for the COPD. It's not for the diabetic. It works in diabetics or COPD in the acute phase. But once again, we're
Yeah.
talking right at the beginning of signs and symptoms. Those studies for oscillocoxinum, for instance, they were within the first 48 hours where they saw the benefits. So it's the acute phase where we kind of want to get going, kind of that, that ounce of prevention's worth a pound of cure. It's not necessarily prevention, I wouldn't say, but when those symptoms start, you have something you can go to.
Beautiful.
Absolutely.
One of my favorite other homeopathy remedies is
I
arnica,
knew you were going
arnica
to say that. I
montana.
knew you were going to say
That's
that.
my.
I love it
I've been
too.
using that for forever, and I think that as because I played volleyball in high school, and I
Nice.
would just have bruises. I
Sure.
mean, just everywhere.
Yeah.
So having that on hand
Yeah.
is just something that I can have in my backpack, no problem. So that is one of my other favorites of
Yeah.
homeopathy.
And I'll piggyback off of that. There's another one by Boiron that I have always, and it's for allergies for
Oh,
kids.
yeah.
I have their allergy relief one,
Yeah.
and it's
Yeah.
a
Yeah.
staple,
There's a sinus calm. And
especially in Georgia.
yeah, exactly. And it's funny when you mentioned arnica. I knew you were going to say that. That was a big one. So I told you guys, my first practice, I work with migrant Mexican farm workers in the strawberry fields, and then I transitioned the practice over to Beverly Hills. And if you may know there's a little bit of plastic surgery done in Beverly Hills. And what happens is they come out with bruising, and guess what? That's where I learned about arnica. And I was like, hold on,
Yeah.
this bruising is going away. What happened there? And that was my kind of time, once again, that California time when I saw that people were getting better with different remedies that I knew in my Western medical school here at Columbia in New York. Now, there is a
Yeah.
time when there's Western meds. This is not to pounce all over Western medicine, everyone. There's a time and a place, but this is about us getting on it early and thinking about homeopathy and those things that are closer to the earth in the beginning and seeing where we go.
Right. And knowing that it's safe and proven effective.
Right. Very
Key
key.
points there. Are there any other points with homeopathy or any other lesser known favorites maybe of yours, or any other little bullet points that you can think of that could help educate or empower any parents listening or any individuals listening that they would feel comfortable kind of going to as an acute source
Right.
of help?
Well, one of them was the arnica, which I'm glad that you mentioned. The other one, when you mentioned sinuses down in Georgia, I'll have some patients who were younger, who have issues as far as with asthma and so forth, which are always kind of triggered by sinus issues. And so they love sinus calm. Once again, it's another beautiful remedy that helps around the cold and flu season, and for my asthmatics who are really triggered by anything that's an allergen, and so forth. So those are kind of a lot of my go-tos to kind of have in my toolkit, that really take care of a lot of the acute things that we kind of get as people, each and every day, whether we're in the Northeast or down in the South.
Right.
Beautiful.
Awesome.
So is there any other, I know we talked about allergies and sinus and cold and flu and bruising. So is there any other homeopathy that you have in your medicine cabinet that's just kind of a staple that when you run out, you make sure that you go and get, and it's just always on hand?
For me, I'll tell you, it's got to be the oscillocoxinum. And the reason why I say that, everyone, is because I travel a lot. Well, I should say this. I still travel a lot, but I really traveled before COVID came. And I was always on a plane. And one of the things I do, it's kind of off-label, I guess, in a sense. But before I hop on any plane, or if you're going on a plane or train or what have you, I always have that and take it ahead of time, just to make sure that I am kind of, in a sense, for me, a little protected. Or if I start to kind of come down with something, that I have it on hand. But it just speaks to the fact that it's mobile. So if you had to ask me and pin me down and look in Dr. Redcross's pockets, or my bag, you'd see that I keep a Oscillo on hand a lot, especially when we as a family are traveling and someone's saying, I feel like I have a little tickle in my throat, or that I'm kind of coming down. It's done. The kids even know to ask for it. And so they usually, even now, they're old enough to when they have their own, but it's important to kind of have them with you. And the good thing is, like I said, they're all portable and you don't have to have a bottle of water with you. That's a big deal.
Right. Oscillocoxinum is
Nice.
You did it.
She did it.
Christy's brain. Yay!
She did it. I'm not even going to try.
Okay, so it's a thing that we make each other say really hard words.
Yes. I see. Well, you're the winner today.
Yes. Gold star.
Well, Dr. Redcross, thank you so much for just the insight into homeopathy and having our audience get to know you as a human, and how I love just to see you kind of bridging gaps, bridging gaps between all types of medicine. It's something that I stress a lot. And we were just talking about this on a previous episode where, I feel like once practitioners kind of trend a certain way, right? Once I come into more of the functional medicine, a lot of those practitioners then shun other parts of medicine. And something I work really hard to do is to bridge them all together, because there's a time and a space and a place for every part of medicine to benefit that patient, because every human is different in what they're going through. So I just appreciate, I think it's more rare to find MDs who are on board with that and trying to do that. And so I just really appreciate your approach in trying to bridge that gap and help your patients and your patient population with proven, proven modalities, but that might have been something outside of the quote norm or what you were taught. So you're a rare breed, and we appreciate it over here.
Well, thank you for having me. Thank you so much. It was important to evolve with the patient. Like I said, this is what I do. This interview, this time together is about you, and about those who are smart enough to follow you. It's the reason why I wrote my book, Bond. It's about bonding with each and every one of you, that focuses on trust, respect, empathy, and communication. So I just want to thank you for having me on and allowing me to be a part of your platform today.
Thank you so much. And speaking about your book and how we can learn more from you and how we can connect with you, where can our audience connect with you?
Oh, sure. So please, and I mean this is not lip service, everyone. Dr. Ken Redcross is where I am on Instagram and Facebook or LinkedIn. And I really love meeting new people. As far as my book, Bond, and those things that are important, I'm very proud to say it was #1 on Amazon the first week it came out. But guess what? In the psychology category, I was like, yes. It wasn't about medicine stuff. It was about the feeling stuff, the stuff that, once again, with each patient, and today, my goal is to get into the soul of the patient. And so I felt good that it was where it was supposed to be. So I mean it. Please reach out, say hello, ask questions. I would love to help any way I can.
Beautiful. And we will make sure that all of that is linked in our show notes, so you can connect with Dr. Ken Redcross
and go buy his book.
Yeah. And so I'm hoping that I can sweet talk him and to sending me a signed copy. So it'll go on my shelf.
Well, thank you so much
Oh,
for joining us. We really, really appreciate your time. And we hope to our listeners this has been beneficial to just see that, hey, modalities can come together, work together to benefit you, give you a little more insight on homeopathy, especially during cold and flu
yes.
season, and the words I can't pronounce as
Os-
well.
There
Oscillocoxinum.
you go. You ended on a
There
high
we
note.
go. And until next time, let's discover
together.
together.
We hope you've enjoyed this journey of exploration and learning as much as we have. Before you go, we have a special request for you, our beloved discoverers. We'd be thrilled if you could show your support in a few easy steps. Step 1, if you're watching on YouTube, please hit that like button and subscribe to our channel. Don't forget to ring that notification bell so you never miss a moment of discovery. Step 2, if you're listening via Apple Podcasts, please take a moment to rate and review our show. Your feedback means the world to us and helps others discover our podcast too. Step 3, whether you're on YouTube or listening on your favorite podcast platform, please share the Discovery Doc podcast with your friends, family, and social networks. It's the best way to spread the joy of discovery. And finally, don't forget to follow us on social media. You can find us on Instagram, Facebook, and TikTok at The Discovery Doc. Stay connected with us for updates, behind-the-scenes content, and so much more. Plus, for exclusive content and additional resources, be sure to check out our website at www.thediscoverydoc.com. And while you're there, if you have a burning question or a topic you'd like us to discuss on the show, simply let us know. Thank you, Discoverers, for being part of our incredible journey. Until next time, let's discover together. The content provided in this podcast provides general information and discussions on various topics related to health, wellness, and medical advancements. However, it is essential to understand that the content provided in this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The hosts, guests, and contributors are individuals sharing their personal experiences, opinions, and knowledge in their respective fields. While they strive to provide accurate, up-to-date information, medical knowledge is constantly evolving, and the information presented in this podcast may not always reflect the most current research and medical guidelines. It is crucial to consult with a qualified healthcare professional or medical expert for specific medical concerns. Never disregard professional medical advice or delay seeking medical treatment based on the information presented in this podcast. The Discovery Doc podcast encourages listeners to use their own judgment and discretion while implementing any suggestions, recommendations, or lifestyle changes discussed in this episode. Each individual's medical situation is unique and may work for one, may not be suitable or safe for another. The podcast hosts, guests, and contributors are not liable for any direct, indirect, consequential, or incidental damages or harm that may arise from listening or acting upon the information provided in this podcast. Listeners are responsible for their own health decisions and should exercise caution and seek professional guidance when necessary. By listening to this podcast, you acknowledge that you have read, understood, and agreed to this medical disclaimer. If you have any questions or concerns about this medical disclaimer, please consult a qualified healthcare professional.